South Africa has opened the continent's first wellness centre for LGBTIQ plus people. Now, the Queer Wellness Centre in Johannesburg offers stigma-free sexual and mental health care. Here to tell us more is one of the founders, Dr. Claudia Duval. Dr. Duval, thank you so much for coming through today. Really appreciate it. As a centre that is one of its kind on the continent and not just in South Africa, can you tell us how you aim to address the needs of LGBTI people?
So we have, number one, numerous of specialists and subspecialists who are very well versed within LGBTI medical care. And it's sort of to acknowledge that you have heteronormative care, but then you have like a completely separate set of care that is required for the community. And that sort of extends from psychiatry, psychology, but as well as things like an anal health clinic, full STI screening, sexually transmitted infection screening, urologists, plastic surgeons who are knowledge in trans, affirmative surgery. So it really encompasses quite a big spectrum of care.
Yeah. Talk to us about how you've differentiated yourself from that heteronormative care that you've just touched on. What are the specific needs that you'll be addressing? Because, you know, if one goes onto your website and reads more about you, there's some acknowledgement of the fact that you will find sometimes or often rather, misdiagnosis, right, or underdiagnosis of certain diseases in your specific target market. So why does that happen, and why does the LGBTIQ community or people need a different kind of healthcare?
So I think it starts almost immediately from history taking. So as doctors, we're taught in very much a heteronormative way of taking a history. Are you married? Do you have children? So how are you able to actually open up about what all your symptoms are if that is the platform where you're starting? So what we have is all of our specialists have their own private practices, but they're dedicating time to the space. And by being there, we're saying we're coming to you. We've made this space so that you can be open, you can tell us everything that you are experiencing so that we can actually treat you best. And that way we should be able to get them to the right answer.
So, you know, you speak of, and just to elaborate on that point, there might be certain things a trans woman might not be in a heteronormative scenario, might not be screened for or tested for when she presents with certain symptoms. What might those be?
So one good thing would be in terms of just cancer screening. So if you have a trans woman who's been on hormone therapy for 5 years already, they would need to be screened for both breast and prostate cancer. Now, if you don't know that, and this isn't like what you are aware of or what your sort of speciality is, you're not going to do that. Also, it would then require a lot of motivation with medical aids, etc., to say, yes, like as much as this says a trans woman, you need actually to test for prostate.
Well, let's elaborate on that very important point that you've just brought up, which is motivating with medical aids that we do in fact need to test for prostate cancer, prostate screening. How are medical aids interacting with the Queer Wellness Centre? What are the kinds of conversations are you having with them?
So at the moment we've had very early conversations. I think one of the biggest things is this really is, in a sense, almost a pilot project because it is the first. And a lot of people have wanted to see what sort of is the response. And I think people are starting to realize now that actually this is really needed. And we've had such a positive response in terms of patients who've come to see us, or the clients who've come to see us, that yes, this is something that they need to focus on and they need to actually start considering in a much bigger scale than what they do.
Elaborate for us about the specialists that you do have dedicating that time to the Queer Wellness Centre, and then also the very specific skills that they all have in terms of treating LGBTIQ people, because of course you talk specifically about the fact that there is a matter of a bedside manner that doctors need to have, an additional set of skills that they need to have, but you know, what else do they have in their arsenal?
So endocrinologist, our endocrinologist has worked a lot with both intersex and trans people's hormone therapy. So really coming just immediately from that background is exceptionally well respected. Our psychiatrist previously worked at the trans clinic with Steve Biko. Same with our urologist. In terms of, we also have an infectious diseases specialist, so to look at the different types of sex transmitted infections, particularly those that are drug resistant. We have an HIV and sexual health expert who has been in the UK in a centre similar to this for 25 years. So each and every single person actually has some experience, and it's not just completely new.
Yeah. We know that in South Africa, of course, we struggle with the quality of medical care that one can have access to if one does not have money. Who can access the services at QWC?
So it is a fee-for-service at the moment, and we are looking at ways to actually make it more accessible. So we do have a few projects that we are coming up in sort of funding that we've been looking at. Again, it's very difficult to get funding when you're starting something completely new, and most places that we had previously approached said, well, come and talk to us after 2 years, and that we see that it is a needed service. So there are things that we have been working on to be able to then have some services be able to be provided for people who come.
And your current sort of caseload at the moment, how many people have walked through your doors, understanding that it is in its infancy, but how many people have walked through your doors so far, and what sort of caseload are you targeting to be able to carry? I imagine there's quite a backlog of people trying to access your services.
Yeah, so it's definitely increasing exponentially, and like for instance, the anal health clinic has had a lot of people request to come to the anal health clinic, same as the sexually transmitted infection clinic, as well as psychiatry and psychology. They've been really the biggest requests. Surprisingly enough, nephrology, which is renal and kidneys, as myself, has also had quite a few people requesting appointments and bookings, and that is most probably due to the fact that a lot of the treatments end up having renal problems or kidney problems.
Yeah. All right. Well, thank you for your time. Really appreciated. Really appreciate it. And
thanks for having me.
Thank you. Well, that was the founder of the Queer Wellness Centre, Dr. Claudia Duval.